All right, welcome everybody into this week's edition of the virtual speaker session. I see the Zoom room is filling up. As always, we invite you to let us know who you are and where you're Zooming in from. We are excited about today's guest. We will be talking with Dr. Amy Snipes. Amy's an associate professor of biobehavioral health at Penn State, and she's going to be talking about her work with immigrant farmers and migrant workers here in the United States and their environment and culture and health conditions and behaviors that affect that population of people living here in the United States. So we look forward to her presentation and a conversation with her. We have a number of questions that have been submitted. If you would like to ask questions, please use the Q&A tab at the bottom of your Zoom video window, or if you're watching on Facebook Live, you can put your questions in the comments and they will get to me and I will ask Dr. Snipes those questions. I see the Zoom room filling up. I see Vicky in Harrisburg and Bernice Marks in Mazatlan, Mexico. Good to see you all Zooming in, a couple familiar names who are regulars here on the virtual speaker series presented by the Penn State Alumni Association. We'll be getting started in just a minute. Thanks for joining us. As always, let us know who you are and where you're Zooming in from. You can drop that information in the chat. If you have questions for Dr. Snipes, you can ask them in the Q&A. We had a couple pre-submitted questions that I'm going to get to today. I see Alice Kopfer. Alice is joining us from Fort Wayne, Indiana. Welcome in, Alice. And Olivia Lewis here in State College and Sue from Harrisburg. Welcome into the program. Where else would you rather be than a Zoom full of Penn Staters? Thank you for joining us. I'm Paul Clifford, CEO of the Penn State Alumni Association, and I'd like to welcome everybody to today's virtual speaker session, which is being recorded. Live closed captions are available for this event. You can access them by clicking on the closed caption button at the bottom of your Zoom video window, and then clicking Show Subtitle. You may also customize your caption view by clicking the stream text link that is posted in the chat. We are live streaming today's presentation, and this live stream has been made possible through the gracious support of a donor and the Fund for Access, Ideas, and Audacious Goals. Today's presentation will be archived and available on our website after the event. This afternoon, we welcome Dr. Shedra Amy Snipes, an associate professor of biobehavioral health here at Penn State. Stories are not always positive, but truths lie within them. This presentation will lay out the narratives of farm work alongside information on the health of farm workers who, in the United States, are over 80% Mexican born. Dr. Snipes will recount her own observations in fields as she has worked alongside farm workers, providing detailed examples of how farm workers are sometimes simultaneously celebrated and oppressed as they toil in the fields. Dr. Snipes will close by highlighting the impact of these narratives on the health of migrant and seasonal farm workers. By telling these stories, she hopes that the audience will be able to better understand in the deeply personal connections that we all have to food, farm labor, and the health of farm workers. Dr. Snipes is recognized as a leading voice on the role of culture, environment, and health behaviors in the United States population of migrant and seasonal immigrant farm workers. Her honors include several media recognitions as well as appointments to the National Advisory Council on Migrant Health, which advises, consults, and makes recommendations to the Secretary of the U.S. Department of Health and Human Services concerning the organization and operation of migrant health centers across the country. Dr. Snipes earned her PhD in biocultural anthropology from the University of Washington in 2007. She is a former fellow of the Kellogg Health Scholars Program at the University of Texas MD Anderson Cancer Center and the National Cancer Institute Education and Career Development Program at the University of Texas School of Public Health. Ladies and gentlemen, please welcome Dr. Amy Snipes.
Hello and welcome everyone to the presentation. I just want to ask the panelists by testing my mic to make sure it's working.
Everything looks great.
Perfect.
Sounds great.
So I'm going to share my screen. I'll be running my own slides today and go ahead and get started. So it's important to me that I say thank you first, both professionally as well as personally. So I want to start by thanking the Penn State Alumni Association, as well as its leaders, for asking me to do this presentation. I'd like to thank the attendees for being here in the middle of your day, your important work day, to hear about the work and labor and health of farm workers. But most importantly, I really want to thank farm workers for who they are and the ways in which they enrich my studies, enrich my life, as well as the world. And I'd like to start with this quote from someone who I've used the pseudonym Angel, who does really amazing work, and for me, situated quite beautifully the importance of his work to the world. Angel says it's very nice to work in the field because all of the people who work in the field are producing food for the entire world. Because the entire world eats from the field and not from the offices and not from the warehouses, not from the stores even, but from the field. And so when Angel told me this story and was recounting his work and the importance of his work, it wasn't to diminish everyone else's work and diminish my own work, since I work primarily in an office. It was to amplify the beauty of his own experience in the field, as well as to amplify his appreciation for his contribution to the world. And so I want to say thank you to all of the farmers, all of the family members of farmers who may be here today, but all of the farm workers who supply our lives with food. Today, I'd like to spend our time talking a little bit about background and context, as well as giving you some narrative findings from studies. First and foremost, it's important that I tell you why I study farm workers, to introduce a little bit about the threats to health that farm workers face. The lens that I'll be using today is primarily focused on injury, and I'll also tell you about my own perspective as a biological anthropologist and the way that I see this work. I'll provide a few narratives. For sake of time, I'll only do two, and hopefully that will leave lots of time for questions and discussion. So let's begin by talking about why I study farm workers. So first and foremost, farm workers are uniquely linked, right, to our great American story. And though most of us supply our homes and our bodies with food from a local grocery store, that's not where food begins, right? Our food begins with farming and farm workers as producers of our food. Food and nutrition have really been linked to public health and improvement efforts, from anything from weight and obesity to cancer prevention. And so we really want to think about food and nutrition as linked to not only the food that we eat, but also who are producers of food. These two issues have emerged as prominent health, but also social issues. And so today I'd like to draw upon not only the health and social issues, but highlight how food systems, including its players and contributors, matter for health. So farm workers are primarily Latino. And I'll say Latino, and that will encapsulate Hispanic, Latinx, Chicano, and a host of other ways in which we describe individuals of Latino ethnicity. There are approximately 3 to 4 million farm workers who live in the US. That number is an approximation. It is difficult to count farm workers for many reasons that I'll go through today, but farm workers are difficult to count, but there are approximately 3 to 4 million farm workers who live in the US. Most farm workers are Hispanic or Latino. So over 90% of farm workers identify as a person of Hispanic or Latino background. And among all farm workers, they're mostly Mexican born. Anywhere between 75 to 80%, the stats move back and forth depending upon the year. But between 75 to 80% of farm workers are born in Mexico. But about 75% of farm workers are also immigrant, by saying that they're not US born, but most are born in Mexico. Among immigrant farm worker among immigrant farm workers who are born in Mexico, most are born in central Mexico. So when I say central Mexico, I mean Michoacan, Jalisco, Guanajuato. Many farm workers are male. There are transitions in the demographics. It's starting to become closer to about 40% female, which is representative of my own experience in the field. And farm workers are starting to also age in the workplace, but there's still, the median age is around 25 to 34. And the primary language chosen by farm workers is Spanish. Farm workers also have these interesting work-related occupational contexts. So first and foremost, I want to talk about the way that farm workers work. Many of you will know what piece rate is, either because you have worked on a farm yourself or you understand the piece rate system. Being piece rate means that you are paid how much you pick, right? So if you pick a lot, you get paid kind of a lot. And if you pick a little, you get paid a little. And so under that circumstance, there are really these incentives to work quickly and maybe even to forego safety circumstances that might mitigate the risk that one would take in the field. So when farm workers work piece rate, you have to work to maintain the minimum wage standard in your state. So if you don't work enough to get paid whatever the minimum wage is in your state, you're not allowed to work. And that's also just a kind of a labor standard, and not just the employer being a bad employer, but that's a labor standard that one has to work quickly. But you can see these fine lines between working piece rate and having to meet a minimum standard and having to work quickly to meet that minimum standard or to even get paid enough to feed your family as these incentives to be lax or to relax these safety standards. Farm workers are either migrant or seasonal. This is primarily because farm work is a seasonal labor condition. There is almost no crop that's produced year round, even though there might be ag in a region year round. Farm workers will follow a crop, maybe even nationally, in order to figure out how to work the full year. So farm workers who migrate more than, I believe it's 50 miles to work, we call them migrant. And then other farm workers are seasonal, who take on seasonal employment in a particular region. But I want to point out, very importantly, that many farm workers, nearly 50%, are documented and or legally authorized to work in the US. There are many misperceptions or myths about who makes up the farming occupation. And many of my students, for example, will ask, like, over 90% of farm workers are undocumented, and that's not necessarily true. Many farm workers are documented and legally authorized to work in the US. I want to pivot just a little bit and talk about the threats to health for farm workers. And again, for this presentation, most of what I will cover are the threats to health regarding injury, but let's broaden that scope just a little bit before we narrow down. Farm workers face lots of work-related burdens, including these hazardous work conditions. One of the other pieces that I study is exposure to chemicals and ag-related chemicals, including pesticides. And so working in those conditions where there is almost endless exposure to either the chemical or the chemical byproduct or the chemical residue includes an additional layer of farm workers' exposure. There's also some transient and very uncertain lifestyles when farm workers are migrating. You may migrate to a location and think that there's work there, and there might not be work, or you would migrate and see something like this as your house, where there could be very uncertain living conditions. The amount of pay that you would earn is also really quite uncertain as farm workers are migrating from place to place. The work can be long. I have done this work. I am an anthropologist by training and trade. So I do this work, and I have worked as little as 5 hours a day, but typically 12, maybe 16 hours per day is the standard workday, certainly more than the 40-hour work week. There are also many disparities. And so when I think about the word disparities, I think things that are unjust or avoidable. And there are limited access to healthcare. There are migrant clinics available. Hopefully some of the migrant clinic audience is here to talk about the amazing work they do. But in areas where there's not a migrant clinic, there is limited access to healthcare. So we've talked about the substandard housing, but farm workers are a part of what we call the working poor. The average farm worker family, and this is important, the family earns about $12,500 per year. That is well below, it's less than half of the poverty standard for a family of four. So farm workers are represented among the working poor who work every day, many long hours per day, and still don't have enough money to meet their basic needs. Many of these perils, so both the social, the health-related conditions, they go either unrecognized or untreated. And one of the places in which I'd like to talk about unrecognized or mistreatment or not being treated at all are injury. Farm workers have one of the most hazardous jobs in the US. So I know some of you who may not be familiar with farm work might be thinking, well, what about the construction workers or the miners or the taxi drivers, for example? Those are also dangerous jobs, but I want to talk a little bit about why farm work is also a dangerous job. There are about 120,000 work-related injuries, disabling work injuries in ag per year. Also, the ag, forestry, fishing, hunting sector, so that's all combined as one sector, has a higher fatality rate than any other industry. On a farm, I just want to zoom in a little bit here. So on a farm, about 100 children are killed on a farm per year. That's a devastating number. And nearly 25,000 injuries occur among adolescents who are under 20. Let's compare the fatal injury rate across sectors. So again, you might be thinking about the overall number of injuries in construction, transportation, but the rate of injury in the ag, forestry, fishing, and hunting sector far exceeds the rate of fatal injury compared to other industries, even something like mining and construction. The rates of injury are also really quite intense among Latinos who are ag workers. So Hispanic or Latino workers face the brunt of injuries that are faced by farm workers. They are grossly overrepresented in the fatal injury, but also just the overall injury that occurs on a field. And the overall fatal injury for farm workers is higher also than any other industry in the US. And then among Latinos who face injury, the risk is greater if that person is an immigrant. So this is comparing Latinos who are immigrant versus those who are US born. Immigrant Latinos have an even greater risk of facing an injury and a fatal injury compared to all other workers. So I want to pivot just once more and then talk about my perspective on all of these issues, in particular around health. As a biological anthropologist, I really see every biological event as mediated through these social and cultural beings, as well as cultural and social notions. Those might include things like power, structural inequality, but also access. Which bodies have access to health? Which bodies have access to clean water? Which bodies have access to healthy food? Which bodies have access to increased risk of injury? Which bodies have access to treatment for those injuries? And so to disentangle the ways in which power and inequality, but also cultural or culture-bound notions, disentangle at that access. So it could be a cultural belief that mediates which bodies have access, but also it could be a power that mediates which bodies have access, but also structural inequality that mediates which bodies have access. And so I'm interested in these phenomena that combine culture with also social and political constructs of health. I see this as a way to think about the effect of social inequality on the health of populations, but also in which those populations, the ways in which those populations may lack power or other social forms of agency. And the way that I see injuries as experienced by farm workers as entrenched, right, in these cultural, social, political, and economic phenomena as really embedded pieces to the way that we see health. I want to illustrate the way that I do my work through an example, which is also an example story, by telling you the story of someone that I've called for today, Elena y Jose, or Elena and Jose. So this is me with a farmworker friend, and I'd like to talk a little bit about the work of Elena and Jose. As I pull up this story, great. So as a biological anthropologist, I see myself, or I see anthropologists in general, as practitioners of narrative knowing. This to me is the reconceptualization of life events, perhaps even through stories, when we use narratives to give information. And so to introduce my perspective, I want to tell a story. And this report or the story will be to use an example of the ways in which I contextualize the empirical and frame it through a narrative and frame it through a story. And so I'd like to tell you the story of Jose and Elena. I sat with Elena as we gathered our gloves and gulped the last bit of coffee just before dawn. Jose was at the door and he was leaving to start the car. His hands shook a little as he gripped the door. And Elena looked at me saying, Jose is good at his job, but the nervios have him. And he thinks it's the pesticides, but he just needs to be cured. Jose Ortega is 43 and a migrant farm worker who lives in a small agricultural village called Sun City. His workday is spent removing flowers from cherry trees, pruning, or cutting asparagus for the harvest. But while Jose is working, his hands shake beyond his control. And despite this, he is considerably good at his job. And even more, he's admired and respected among his companion farm workers, as well as his employer, for his ability to work through the nervios. Typically, nervios is a Latin cultural bound phenomena, which is believed to be associated with fear, anxiety, a traumatic event, or stress. Typically, nervios works in this way in which farm workers are able to maneuver around stressful events and describe it through a cultural and physical phenomena. But in the context of farm work, the folk term is applied to the physical symptom of uncontrollably shaking hands. And many farm workers don't know the cause of nervios, but Jose believes that his shaking hands, are associated with the chemicals. When I asked Jose to tell me more about what the chemicals are and what they do to him, he answered me by saying, the chemicals are pesticides and they smell bad. That is how we know what they are. When we are working, the odor is foul. The smell is so bad that we're covered in it. And I don't know why, but the smell stays on us forever. And for some of us, the smell hurts us physically. And for me, it hurts my hands and it makes them shake. This quote is from my ethnographic work. And so for me, ethnographic work is portraying this research where I take on the life and lifestyle of a farm worker to engage my research and to really see what a phenomena looks like. And in this quote, I really see the ways in which culture and health, this nervios phenomena, for example, is linked to a way that farm workers' distinct perceptions around meaning of injury and things like pesticides are utilizing their stories. And I utilize these stories to apply measurement to biological phenomena. For example, if a farm worker talks about something like the smell stays, I'm able to see how absorption of chemicals is absorbed in the skin, where I not only see through their words how chemicals might be absorbed through the skin, but what it feels like around risk perception, right? Does it matter? Are farm workers afraid? Are they worried? Are they concerned? But also to think about duration and intensity. The smell stays. It stays on us forever. It hurts me. It makes my hands shake. And so I use these phenomena, these narratives, to help illustrate underpinnings and understandings of biological risk. So let's talk a little bit about the narrative findings, the two stories that I'd like to share with you today. First, I'd like to tell you a story of Peter. Again, changes have been made for anonymity. Peter was one of my absolute favorite people in the field. He was one of the first people who told me that I didn't know what I was doing. He's like, Amy, you have to know this and this and this. And so he sat with me for really quite a long time to understand the nature of farm work and for me to become good at it myself. And he and his family really helped me as I moved through the fields in the beginning of my ethnographic work to understand the difficulty, but to become good at it. But also Peter was just this big personality, person who loved his family, loved his work, and also loved providing food for the world, as described in Angel's quote. So I'd like to tell you the story of Peter and one day when he had an injury. Peter Campos lives in a home that he recently purchased for his family. He's a man of much responsibility and he works to earn money for his wife and children. He also works on behalf of his aging in-laws, of whom he's the sole financial supporter. Peter is an immigrant, and he moved to Texas from central Mexico 8 years ago when recruited by an American produce company to work in the United States. The company paid for Peter's transportation costs as well as housing needs and gave him documents called papers in which to work. After working for 2 years, his employer, Peter was joined by his wife and in-laws in the US, and now he has 2 young children, both girls. His wife is pregnant with their 3rd child, which they both want to be a boy. Peter and his family are also happy, but they're worried about the daily life that they have in the States. And their concern began about 4 years ago when Peter discovered that his papers, which were provided by his employer, were false. He felt betrayed, he felt scared, he felt angry because Peter's documentation problems would not only affect him, but also his family. And what I'm saying here is that the papers that were given to him, the documents, were not legal documents, and Peter was unaware of this. So Peter didn't know that his move to the US was unlawful. The company had paid and had helped him with his transportation costs, his housing needs, and they helped with all of this upon his arrival. They recruited him. And Peter, in his eyes, meant that everything was legally authorized. Now, Peter continues to live in the US with a fear that his status will be discovered. Moreover, he fears returning to Mexico because going back to Mexico by traveling the route of undocumented strangers will be dangerous and risky for him, his family, and his in-laws. Moreover, there are no jobs waiting for him in Mexico. So he stays in the US working for the same employer whom he distrusts. He feels trapped and without control of any kind. Peter's lack of control magnifies when he encounters an injury at work. And while working with heavy machinery, a spout loosened and a nail was accidentally driven through his foot. Although Peter reported the accident to his employer, he was asked to keep working. His boss indicated that the day would soon be over in about 4 hours, and that Peter could deal with the pain until he was released from work. And so Peter recounts his injury this way. Well, this week I was working when a nail was driven through my foot. I also cut this finger, as he pointed to his index finger. And what happened, I asked. I cut it with a nail. It loosened up and I was changing the metal. And I put a nail in it and I turned it and I cut my finger. And then the nail shot through my foot. I went through my boss to show him. Blood was everywhere, but he wanted me to stay at work. He's selfish and he doesn't care if we hurt as long as he makes money. So I also had to work with my finger, hurting and everything, all day. I'd like to share with you one additional story before I wrap up and perhaps take your questions. This is Angelica. Angelica also became a friend of mine. I would actually have dinner with her every Monday, she and her family. So we would go over and cook meals together. And I'd like to tell you the story of Angelica, which is really quite an intense story of injury. Angelica Hernandez is a 39-year-old female farm worker. She was born in the United States as a daughter of 2 first-generation immigrant parents, Miguel y Rosa. Angelita's parents were both farm workers. Angelita began working in the field as a child, and she recalls these vivid and pleasant stories of working with her siblings on her father's cotton farm. She hated the work as a child, but she loved the time to spend with her siblings to play, to learn, and earn money for things like candy and toys and maybe even school supplies. Today, almost 20 years later, Angelita works as a migrant farm worker. She's married to her husband, Jaime, who's a day laborer who works in the field of construction, and together they have 5 children. Angelita's work involves not only her, but her children also. She and her 8- and 5-year-old travel the country as they look for work in corn, jitomates or tomatoes, cherries, as well as apples. Currently, she and her 2 children are working in Texas in the cotton fields, and their tasks are to weed the cotton fields of unnecessary wild plants until harvest. And because the machinery at her employer's farm is unreliable, Angelita and her children sometimes harvest or pick the cotton that was unable to be retrieved by the tractors and other machinery. They pick it by hand. Angelita dislikes this work, and she also dislikes weeding the cotton and harvesting the cotton, but she's good at it. She's been able to weed and harvest the fields quickly, which is a skill she learned from her father when she was a child. Her skill has earned her an important responsibility among her fellow employees, and her position allows her to choose which farm workers her manager will hire. Moreover, she organizes and manages the daily work of her companions in the field by choosing which fields require immediate work and which areas can be delayed until the next day. With Angelita's work come injuries, sprained backs, cuts on the hands and fingers, and falls. They're all common among Angelita and her companions. Such injuries are rarely reported because the farm workers who work beside her lack health insurance or they lack the money for the copays. So self-treatment is common. Which brings us to Angelita's story, which intensifies as she discusses the pregnancy and birth of David, who was nearly born stillborn as a result of her working in the fields during her pregnancy. And here is Angelita's story in her own words. The last time I had my baby, I was out in the fields, but the doctor told me to come back into the hospital. He said, you need to come in because it doesn't look good. I said, why? I have to go out there back to the fields and I have to work. And he replied, no, if you go back out there, you can injure your baby really badly and I'd have to press charges. So the doctor told me you have low amniotic fluid and you can have your baby now, but he could also be blind and maybe he might be born stillborn. Things don't look good. Is stillborn dead? I said, yeah. Then he said something else like, I couldn't remember because when I heard stillborn, that's all I heard and my ears were still ringing. So I left the hospital and I had to come back to work to find someone else to run the field for me. I had to pack all my stuff for the hospital because the doctor explained that if I was not back in an hour, he was coming to get me. He might have pressed charges for neglect of an unborn child. He said it was that serious. But things like that, farm workers don't realize because we're out there just trying to make money. So I came back to the hospital. I was in the hospital for at least 3 days. And even while I was in labor, my boss was calling. He said, hey, these people aren't doing their job. Turn off that phone, my doctor was shouting. You're going to have this baby. Turn the phone off. And after I had the baby, a couple of hours later, I talked to my boss. He wanted me to start working as soon as I got out of the hospital. And I told him that I couldn't. And I waited for at least 2 weeks. And I said he had to wait for at least 2 weeks, maybe a week and a half. But unfortunately, after her pregnancy, Angelita learned that her boss would fire her if she didn't return to work. So she returned to work within 2 weeks of giving birth to David, and she tells us her story. I went back out to the fields. I couldn't lose the job because it's my summer pay to feed my family. And my boss said, okay, if you can't handle having a baby and coming to work, I'm gonna have to hire someone else. So I went back. I had no choice. So I had to say no to myself, no to my baby. And I told my boss, yes, that I would go back to work. And I did. So I'd like to draw a few conclusions here before the Q&A period. Latino farm workers are often asked to go well beyond the physical capabilities of their bodies, of the weather, perhaps even of the crop in order to meet their employer's demands and maybe even the world's demands for food. These conditions put productivity first, and sometimes farm workers' security, their health, their well-being last. And farm workers face factors also like immigrant and ethnic discrimination that might keep farm workers from reporting their injuries. For example, in each of the stories that I've talked about today, both Angelica as well as Peter felt like if they were not immigrants or if they were not Latino, that they would have been able to maneuver the system in a more fair and just way, that their employers would not have asked them to go beyond their physical capabilities, that they would have been able to utilize the systems of fairness and justice that many of us take advantage of as we experience an injury and a traumatic event. And so in these ways, factors like immigrant identity or not being born in the US may prevent farm workers not only from reporting their injuries, but also being treated with their injuries. So I'd like to take this time again to say thank you to those of you who are listening, those of you who are still here, to the team for asking me to do this presentation, to, again, first and foremost, the farm workers who do this lovely and important work, but also who face the toils in the fields. And I will dedicate this work to them and continuing to fight for policies and perspectives that will enhance their health and well-being. And with that, I am happy to take questions.
Thank you, Amy. As we mentioned, you can ask your questions in the Q&A tab. We did have a number of questions that were submitted, but let's start at the very beginning. Talk a little bit about if you have any information about this, the impact of farm workers on the American kind of agricultural industry, percentage that they make up of the ag workforce, and kind of what's the impact if we don't have migrant farm workers.
So so you're asking about the percentage of workers who are migrant within. Right. Okay, so I did mention that there are about 3 to 4 million farm workers who work in the U.S. We do classify farm workers as either migrant or seasonal because some farm workers move kind of, that's a fluid designation. Sure. Where farm workers are seasonal sometimes and migrant others. The stats also move quite a bit. Anywhere between 60 to 80% of farm workers are migrant. And so we do have a very healthy proportion of individuals who are migrating through the system, but it also, those stats are as low as in the last NAS, which is the National Agricultural Workers Survey through the Department of Labor. There were only 35 to 40% of farm workers who were migrating and others are seasonal. It depends on the year, it depends on the crop, it depends on how ag is doing for that year, and even what the immigrant influx of workers is, but it's a fluid designation. On the low end, about 40% of farm workers are migrant, and on the high end, as many as 80 farm workers are migrating throughout the year to do work. Did I answer all of those questions?
Yeah, absolutely. What are some of the challenges that you find in advocating for labor issues of the farm workers, for advocating for kind of work standards, all of those kind of things that you do some advocacy work on? What are some of the challenges in that space?
I find that the policies moves more slowly than we need them to. I think that's a continued frustration. As with all policies, right? I don't think this is unique to ag, but for example, I do sit on a board of really amazing scholars, advocates, community health workers, migrant clinic staff who we all advocate and try to move policies forward at the national level by recommending changes directly to the health secretary, so the U.S. Health Secretary, on changes that have to be made for farm worker health. That moves a little bit faster because we have the direct ear of the U.S. Health Secretary, but an example is at the height of COVID, right? When we were making recommendations to reduce and mitigate the spread of COVID, which had a devastating effect for farm workers who in that very early period were considered one of the most important essential workers, right? So before the rest of us were essential, farm workers and health workers and transportation workers, like there was kind of that a very small list of individuals, but we needed food, right? So farm workers, without the needed protections, before we really understood the disease, we're still working closely, working without proper protection, working without proper housing. As many as 8 farm workers can be in one bedroom, according to housing standards, according to HUD, the US Housing and Urban Development structure. And as many as 11 to 15 farm workers can live in one house. So you have these legally authorized housing standards where it was impossible to isolate. It was impossible to stop the spread of COVID, both in housing as well as at work. And it took a while for those policies to catch up to the science and catch up to the standards. So I think the biggest frustration is knowing what has to be done and having just having barriers to the pace in which changes can be made.
So one of the things that I've learned over the years about this topic is that, in the 60s, the 70s, even into the 80s, the border was a lot more fluid than it was today. Migrant workers or seasonal workers could come across, could work, and then go home. As kind of the border security tightened over the years, there was more apprehension for migrant workers and seasonal workers to come, not to come across to get the work, right? Because they could send money back, but then to try to make the trip back. That they were seeing that if they went back, they might not be able to get into the United States. How have you seen kind of those migration patterns change over the years, and did that come up in some of the work that you're doing?
I'll try to first back up a little bit and talk about just migration broadly, right? So, so we think about like internal migrants as well as kind of migrants that move between countries and between international borders. And when I teach a course, I have a course on immigrant health. I tell my students kind of, if you weren't born in State College, you're also a migrant, right? And we think about how much it took for me, for example, a Georgia resident, to move to Pennsylvania. That was a big move, right? To pack up all my stuff in my life and to leave my family, to go to a different place for work, right? So I'm also moving for work and being invited, like Peter, to move for work, and that's a big move. And just like most people who migrate, we move back and forth to see our family. But I don't want to kind of undervalue in my answer the degree to which farm workers are giving up a lot to move, right, for work, and as well as the degree to which we benefit from that move that farm workers make to work. So we're as Americans who consume the food and all of those things that farm workers are giving to us, we are absolutely benefiting from that movement. The changes in the migrant pattern, again, that changes per year, and it changes based on the way that borders work. On the Texas-Mexico border, that is a place where farm workers would return, and there was that fluidity. That fluidity has changed for many reasons, not only because of policies on the U.S. side, which have been detrimental, I think, to most immigrants who are farm workers or not, but also some of the dangers on the border in which farm workers move back and forth. It's not a safe transition always back to Mexico to move through the deserts because the routes have changed and because of just some other situations. And so there are many factors that keep farm workers in one place or the other, as well as the fact that, I just want to underscore this again, that employers want farm workers. They appear through H-2A visas, they appear through recruitment, and these are ways in which farm workers come and stay, not just because it's also difficult to move back, but also come and stay because once an employer hires someone who they think is valuable, just like Penn State might hire someone they think is valuable, retention is critical. Right. And so an employer will work to retain a worker despite their visa status, for example.
Marina actually has a question about H-2A workers. Through your work, have you spoken to H-2A workers And if so, what are some of the unique disparities, vulnerabilities, and also unique experiences that H-2A workers have?
H-2A workers are a common, so H-2A is a different class of a visa. It is a temporary authorization to only work in ag. One should not have an H-2A visa to work for a long time.
Right.
And as a part of that H-2A status, you should have a minimum threshold of pay. You should have kind of these minimum housing standards. And so this is a special visa in which workers are allowed to work only in crops that are also not year-round crops. So for example, mushrooms, which are a year-round crop that we grow in Pennsylvania, H-2A workers are not yet allowed to work in mushrooms or things like citrus or just whatever it is that is grown year-round, which is meant to be a temporary visa. Unfortunately, H-2A workers are not captured in many stats. So they're not captured, for example, in the NAS survey. The NAS does not survey. The National Agricultural Workers Survey through the Department of Labor does not survey temporary workers. And many of the health profiles don't survey H-2A workers. And for that reason, they sometimes slip through the cracks of the knowledge that we have on the unique issues. Sometimes H-2A workers will say that they don't have the same agency to advocate for a fair wage, the same agency to advocate for I don't know, treatment for injuries, those kinds of things, because if they complain, they're easily sent back home through this very legal mechanism in which they can just return without having protections in place. H-2A workers also leave their families behind, right? And don't have the social or stress-related support that they need when they encounter those barriers. So H-2A workers do absolutely encounter these places in which they slip through the cracks and are not always able to actionize the legal protections, which are written into law, but those are very loose and I'd say maybe even weak policies that could be strengthened over time. H-2A workers, according to there's a bill on the floor that's the Farmworker Modernization Act that would allow a pathway to citizenship for farm workers. H-2A workers are not yet included there. But other farm workers are. Just for sake of knowledge for the audience, you would have to, just to begin the work, if it's passed in the Senate, you would have to work another 5 years in ag after you're granted papers. So it's a way to make sure that that if there is a pathway to citizenship, the farm workers would have citizenship and still remain or have authorization and remain in farm work.
So Marie has submitted more of a comment than a question. She said she did a summer job working with migrant workers' children during her college years in 1958. The workers were all American then, not immigrants, but she finds it fascinating to hear about the current problems so many years later. Another question. Oh, go ahead.
I just said thank you, Maureen.
Another question coming in. This is from Esther. Esther wants to know if you could speak to the impact of climate change on farm workers, thinking of the farm workers who continued to work when the fires raged during the pandemic. I'm thinking of those particularly in California.
In California and other places. So Colorado, I can't even remember all the places where there were raging fires.
Oregon.
Yes.
Yeah.
It was devastating. It was, I don't know if you could, those of you who are able to Google the photos, there was just red sky, right? Red sky, dense air that you can almost touch, right? You're not supposed to just touch the air. You're not supposed to be able to kind of cut it with your hand or a knife, but literally under these circumstances, during the height of COVID, right? When we're supposed to be masked and all of those other things, farm workers were working while we saw the fires in the background, while intensive smoke was literally very, very close. There were some advocates who went out and were advocating for farm workers to not be so close. They were told, we're essential, we have to do this, we have to work. And so the intensity of not only sun safety, heat safety, right? Heat safety is critical. Individuals die in the field from exposure to just sun in a non-COVID or a non kind of extreme fire circumstance. Individuals die of heat stroke, of just being in the sun too much. The PPE that's supposed to protect you, farm workers usually wear PPE because they're either exposed to things that they shouldn't be breathing in or chemicals. So that also makes it more difficult to keep that hot stuff on as you're working. So when we layer on climate change to the existing circumstances, and perhaps even layer on COVID as well as climate change to those existing circumstances, it becomes an area in which advocates think about these intersectional policies. We call them sometimes health in all policies, where when we think about, for example, a PPE structure or an injury structure, we think about the total health of the farm worker. The PPE has to be breathable. We have to make sure that we have laws that protect farm workers in extreme circumstances. We have to have a special pandemic exercise for farm workers. But the degree to which Esther is correct, and maybe even a friend, Esther Paul, if that's her, then I want to say hello, that when farm workers are working globally, also this is also a global phenomenon, just not in the US, that the crops change, the migrant patterns change, the availability of money to be earned for one's family and one's livelihood. You then have to move more in a dangerous circumstance where you're maneuvering around the fires and around the heat, and your children are moving with you. So these are compounding. I don't know how to untangle this question because it's such a huge issue that climate change does impact the health and well-being of farm workers with regard to heat safety. And the last thing I'll say there is it may also impact the health of farm workers with regard to the use of pesticides. When we see that the climate changes, the pests change also. So when the pests change, farm owners then have to use sometimes more chemical to combat the pests. So that also layers the sun safety with the climate issue, as well as the exposure to pesticides.
You know, you touched on a lot of the kind of physical ailments that farm workers encounter. How about mental health issues? I think of the category of farm worker that you mentioned that leave their family behind. Talk about some of the mental health issues that are faced by our farm workers.
Absolutely. And I have at least one student who's working on some of this right now. One of the things that were developed early on in my research program was a tailored instrument to measure stress among farm workers. And so some of the indicators of stress are not having enough money to pay your bills, leaving, like the desperation of leaving your family and friends behind, injustice and not being treated fairly at work, having these partnerships where folks are like, I'll hire you if you also do these things for free and your wife and your cousin watches my children for free, then I'll hire you at minimum wage. So these injustices that one lacks control. I remember when I was doing this work and my Spanish wasn't very good, people would say things like, I can't find the door. I can't find the door. I can't find the door. And it was like not having a way out. Right, not having a way out of a very extreme circumstance. And so the stress scale has these indicators of both family stress, economic and kind of work-related stress, but also these bodily conceptions of stress that are layered with these cultural notions, right? So nervios, for example, the shaking of hands, this is also associated with stress. And so one of my graduate students is currently working on the ways in which these cultural bound notions of stress manifest themselves as kind of physical pieces that are uniquely shaped for farm workers, that nervios and other things that may be linked to pesticides, but also manifest themselves in kind of these notions of stress that are measured through our stress instrument. We do find that both males and females indicate high levels of stress. For different reasons, for different anchors. Both old and young indicate stress. So this isn't the kind of survey that we're seeing where we see higher stress, for example, among females, or we see higher stress, for example, among older adults, or higher stress among families. And the stressors among farm workers are so pervasive that we see it throughout the entire population.
Excellent. A couple more questions coming in here. First, thank you for sharing. This is a topic close to my heart. My parents were involved with the Farm Workers Union in the early to mid 1970s in San Diego. where this person was born. I'm disheartened by the callous treatment these people face. I don't buy the economic argument for keeping these people in these conditions. What is the economic impact if we as a society choose to treat farm workers with a level of dignity that's on par with the rest of humanity? Would there truly be a big impact on the cost of our food that we cannot make such changes to the system?
Yeah, I wish I knew more about how to answer that question, but I will answer it this way. So there is the Society of Immokalee Farmworkers, I believe that they're called. This is a group in Florida that has now spread outside of Florida and nationally, where they move into different supermarkets and they try to partner with supermarkets. I think Wendy's is one of the people who actually agreed to this, is to only purchase food from certain markets that will sell their produce a little bit higher, at a little bit higher of a cost, where they can pass on those protections, both in economic value to farm workers, but also give enough economic kind of support to the farms that want to do a little bit better, that they're able to supply more safety mechanisms to farm workers. And the Immokalee farm workers advocate that if we're willing to pay 1 cent more per pound for a tomato, right, that those costs end up making an extreme impact on farm workers. And so some people have done these economic analyses that if as consumers, we're willing to pay a little bit more for your produce, right? And I also just want to, often we'll pay a little bit more for organic food than kind of standard or traditional, we call it conventional farm work,
Right.
conventional, which means typical pesticides are used. But even those costs are not automatically passed on. It just costs more to produce it. So we pay more, a little bit more for it. Farm workers are not necessarily treated better on one farm versus the other. And they work both farms. If we're able to pay more for both, then those benefits are likely passed on to farm workers and farm owners.
So is that the same for the individual consumer? I know you mentioned Wendy's, who's a kind of a large consumer of ag product, right? But is there a way that we can go into our grocery stores, into our our Wegmans or our Giants, and choose products that are handled by workers that kind of where fair treatment is applied to, or a higher standard is applied to the farm workers that work on these products?
Absolutely. I would encourage you. I don't have this list myself because as a person who tries to maintain anonymity between the people who I work with, but the United Farmworkers Union, and I actually follow them on Twitter for this and for other reasons. They do endorse farms, they endorse produce, and they endorse supermarkets, for example, that supply us with fruits and vegetables and produce that have pledged, for example, to do a better job, and have pledged to pass on protections for workers. And so the Immokalee Association is one that has a list of grocery stores that have not bought on, and you can check that out, of individuals who have not supported the Immokalee farm workers positively. And they have a list of those that have, and a list of organizations and restaurants that have. But I would also encourage you to look at the United Farmworkers Union, that has a robust set of information about how consumers can best support farm workers. Yeah, someone is saying UFW updates on Twitter, at UFW updates on Twitter, that you can support the United Farmworkers Union and the information that they are providing for the list of both farms, but also places that you can buy produce that support farm workers.
Excellent. Last question that I will throw at you is, and it's more of a statement / question. Your stories are so engaging. I'm curious if you considered publishing a book of these migrants' personal accounts.
I'm glad you asked that question, because I'm currently on sabbatical. We were joking that I'm doing this talk while I'm supposed to be resting, but that's what I'm doing for my sabbatical work. And so I was actually really quite carefully trying to choose the stories for today. But this book has been a labor of love for me, and the way that I produce the the manuscripts that I publish, for example, are not necessarily stories. Sometimes they are just empirical papers on like, this is the amount of stress associated with this degree of this outcome. And that work is important because those numbers matter in explaining the risks of farm workers. But the stories that really engage us, right? I truly believe, both personally as well as an anthropologist, that narratives, right? Narratives are biological phenomena also, and narratives are powerful, and they also give weight, not voice, because farm workers have their own voice, but they give weight and appreciation and value. And I've collected those stories as well as my own perspective. So this book is also my personal story, and my own personal kind of transition as a person who was a product of the slave trade, right, and
Right.
of the slave industry, and knowing those personal narratives that have been passed on in my own family, but having those stories layered with the farm worker impact. And so that's what I'm working on now. And so maybe stay tuned and we'll see when that book is published.
If people want to find out more information about the work that you're doing, is there a website or a way that they can find some more information about this topic?
Oh, sure. So I do have a Twitter handle. It's at Shedra Amy Snipes. So at SHEDRA Amy AMY Snipes SNIPES that you can follow. So maybe even when my book is published, I'll have that on Twitter. I also have a website on the Department of Biobehavioral Health's kind of list of labs. The name of my lab is BioQual. So you'll be able to find my work either through the departmental website, through BioQual, or at Shedra Amy Snipes on Twitter.
Well, that's all the time that we have today. I'd like to thank Dr. Snipes for joining us. And I also want to thank all of you who've turned into the virtual speaker session. As a reminder, we will be hosting additional speaker sessions in the coming weeks and months. And this programming is in addition to the wide array of online networking events and career programs that are available throughout the year. You can view a full listing at alumni.psu.edu/events. Thanks for all you do for the university, for the glory, and for the future. We are
Penn State.
Thanks, Amy.